to the Fertility Help Hub followers and those joining, please could you explain a little bit about yourself and your tips and advice for people who are looking to prepare for treatment?
Okay, well, I'm a midwife. I'm also an acupuncturist, and I've been a midwife for over 40 years now. So at the clinic, we help all sorts. Can you still see me, Eloise?
Yes,
yeah?
yes.
Yeah. From the clinic, we help people that are just beginning to try for a baby. We help those that have been struggling for a while. We look at male fertility, IVF, early pregnancy. You know, we carry the whole sort of pattern through. And our approach is very much about a holistic approach. So looking at the medical side, which is really important, but including nutrition, which is part of our IVF package in terms of preparation. And then we look at therapies such as acupuncture, hypnotherapy, and counselling. And this sort of like constitutes a holistic approach for us. And I think what's hard to get across is that, you know, when you're preparing for IVF, most women now, there are so many books out there, they know what they have to do with their bodies, you know, in terms of getting the right nutrients in, exercising, all of that. But it's the mind that often gets ignored. So, you know, I think the mindset is really, really important to get right before you go down that IVF route, because it is a very stressful process to go through. Mm-hmm. So, you know, when you think of this whole mind and body thing, it sounds a bit sort of, airy-fairy. But, I mean, it's just getting this concept that all of the body systems are interconnected. So, you know, your brain, your endocrine, your immune, all of that is all interconnected. And the whole thing about this is that, you know, the mind is like an unstoppable train. It's just going all the time with thoughts, emotions, which do form a sort of a chemical reaction in the body. So if you can sort of still your mind, easier said than done, and take some time out to really sort of prepare your mind, I feel that those women that come through, they are less stressed prior to starting IVF. Oh, I can see Simone is joined. Yes,
she's here. Good afternoon. Welcome.
Hi, good afternoon. How are you?
Very well, thank you. How are you? We've just started to briefly talk about holistic.
Very well. Very well.
Good. We've just started to briefly touch on holistic support in preparation for treatment. But before we continue, please could you introduce yourself to our readers and our followers who have joined, and what you do at the Zita West Clinic?
Yeah, so I'm Dr. Simone Rofena, and I've been freshly appointed medical director, but I have been working as a senior consultant first and deputy medical director at the clinic for almost 9 years. So yeah, I have enjoyed this time at the clinic. I've learned a lot. And particularly when I started at the clinic, I didn't know anything about the holistic approach. So during all these years, I have had a chance to experience this with very good results on our patients. So now I've become a firm believer of this approach. And and I think we couldn't do without that, because we can see such a difference in the results we achieve, in the improvements we can make. So yes, I think this is definitely the way forward. And and we are more than happy to help as many patients as we can through the holistic approach.
I couldn't agree more. And I myself had some treatment and support, holistic support, at the Zita West Clinic when I was going through IVF 5 years ago. And so I know firsthand how valuable that is. And Zita, you were just starting to talk a bit about acupuncture and other kind of holistic therapies that people can look into before they start treatment.
Yeah, I was talking about sort of mindset preparation and how, you know, women are very good at seeking out other treatments, but actually doing things that's going to help their mindset, like meditation, hypnotherapy, you know, apps. There's lots of things you can do to sort of still your mind. And I think in the broader picture, certainly when couples come to us and we ask what else is going on in their lives, they're moving house, they're starting a new job. There is a myriad of things that are going on. And I know Simone believes this as well. You've got to sort of be really focused to do IVF. And if you've got all these other distractions going on, it's going to take away from your focus. So things like this are important in our mindset: time management, managing your diary, breathing, just learning little techniques that are going to help you along the way. And I know Simone will agree with me. You know, it's only some of the women we get that are very stressed. Many of them are really busy, aren't they? They're doing 60,000 different things. And I think sometimes you need to take a step back and work out exactly where you're going, what you're doing, and be organized.
Absolutely. Yeah. Yeah, you're absolutely right, Zita. Yeah. I mean, in a busy city like London, that is pretty much the norm. Everyone is busy, but I totally agree with you that, you know, finding the time and the right mindset to dedicate to such an important thing as IVF is crucial. And we see the difference. We definitely see the difference in the outcome. Yeah. So, yes.
And what is good, Eloise, it's no good just having one person that believes in the holistic approach. You know, like Simone now as medical director, it has to feed all the way down to the clinic, you know, from the reception staff to the nurses to the scanners to everybody. This whole message of preparation. I think what clients like is they come and see the doctors, and then they're able to start acupuncture or hypnotherapy, so they're getting to know the whole team. And you probably found that yourself, but how did you find out about it? Was it just Googling, or?
It was through word of mouth.
Oh, right.
Friends having had a great experience. And also I very much wanted the holistic care. I didn't want to be a number. I wanted to get to know the people, and I had great support with immunology, but also from Isabel, so through nutrition, and also hypnotherapy with Maureen at your clinic. So just the whole package together really, really helped me personally. And also, I know that it's obviously you see a lot of patients who are undergoing IVF, but you also see people pre-IVF stage, don't you, who would be looking for support, holistic support, at perhaps an earlier trying to conceive stage. Is that right?
Yeah, I mean, Simone is particularly good at this, because just because you're coming to an IVF clinic doesn't mean to say you're having IVF. So, you know, I know Simone agrees that we look at two things. We look at age and time trying, and anything that Simone can do before IVF, he will do. You know, you have a lot of clients like that, Simone, don't you, that are not ready to go down an IVF route.
Yeah, you're right, Zita. Either they're not ready or they don't need it.
Yes.
And I always say that IVF is the very last resort. If we can find a way to achieve a pregnancy, either naturally or with less invasive techniques, that's always my preferred choice. I only candidate to IVF those patients for whom I think is the only way, or definitely the way that might save them quite a lot of time. And unfortunately, a lot of our patients do not have any time to wait, either because biologically they come to us when, you know, they have already exhausted any other avenues. But generally speaking, when I think there are more natural ways to help the couple, I always prefer to follow those.
Yeah, it's interesting, Eloise, as well, because a lot of women today are so well read. They've been on Dr. Google the whole time, and they'll come into Simone and they'll say, I want this sort of IVF. And, you know, again, it's explaining that IVF has got to be appropriate to you. You know, people are driven by the word natural. So if they see natural IVF, they come along and that's what they want. But don't you agree, Simone? It has to be appropriate. It doesn't, you know, as an individual.
I couldn't agree more. And also patients need to be properly informed. That's what I do during my first consultation. I try to give them as many information as possible, because only by doing so the couple can take an informed decision. Way too often patients are not told what are the expected chances to conceive with any treatment is offered. And I mean, if you don't tell what the chances are with any approach, you know, you are not giving the couple complete information to take an informed decision. So way too often people are often the so-called natural IVF without knowing that actually natural IVF, so without any medication, unfortunately has no more than 10% of success on each cycle. And couple are not told that, and they will need to be told. Then it's their choice whether they want to consider natural IVF or other forms of IVF. But I think complete information should be given to our patients to put them in a position to take an informed decision.
So when you meet patients for the first time and you're looking at their history and how long they've been trying to conceive, what are the kind of things you look for and that you suggest for them to try and to prepare before perhaps going into IVF, which, as we know, is kind of a final resort?
Well, regardless of what will be the recommended treatment, we make sure that the couple is following a good plan in terms of nutrition. Okay, so what they are eating and drinking, because things like alcohol, coffee, clearly we know might have an impact on sperm and egg quality. So diet, nutrition is very important. Some couple would benefit also from having antioxidants, because unfortunately some people is less protected naturally against the negative effect of oxidants, which can come from any source, with a bad diet, with alcohol consumption. Pollution is an important source of oxidants. So we are bombarded every day by a lot of different sources of oxidants. That's why also antioxidants can be important in the preparation. So whenever I see a couple, I always recommend to pay attention to lifestyle, doing physical activity, having a good mindset, so to be balanced, to do what they like to do in terms of stress releasing techniques. That's very important. It's not all about the medications. And I find that those couple who are in a better mindset are those who have better chance to succeed in the end.
Yeah. I ask slightly different questions. For me, I'm interested when somebody comes along, how often they're having sex, if they're having sex at the right time, what are the common mistakes they make around sex. And, you know, it's not focusing on ovulation, it's focusing on the sperm. Are there any reasons why they're not able to have sex? What, you know, what's going on between them, how the relationship is, but also the mindset. You know, one of the questions I always ask is there anything in your psyche that's stopping this from happening for you? And it's quite interesting, isn't it, Simone? Because it's one of the questions on our questionnaire. If somebody's had if somebody's had abuse, emotional, sexual abuse, if they've had trauma in the past, if they've had a termination, these all play into the psyche, and I think they're really important. And I think before any woman or any couple goes down a route of IVF, they've got to feel that they've ticked all the boxes before they get there, because it is a big deal. It's expensive. You want to feel that you're doing absolutely everything. Yeah. And if your IVF fails, and we see a lot of people, Simone, don't we, from other clinics, something different has to happen the next time round. You can't just keep going on and on doing the same thing.
Absolutely, Zita, that's absolutely spot on. On the strictly medical side, so far I've been talking about the preparation, but on the medical review, those things I consider are the time the couple has spent trying to conceive. That's very important, because sometimes it's just a matter of not having spent enough time, or not having tried properly, having sex at the right time or with the right frequency. Okay, so these are things to be taken into consideration to really understand whether there is a problem or it might be just a matter of time. But then, Zita, you're right. For those couple who had IVF before, failed IVF, is very important to consider, you know, which kind of protocol they use, what was the embryo quality achieved. I look at each of these things when I see couple who had failed attempts at other clinics. The first thing I ask is the details of each cycle in terms of protocols, medication use, number of eggs and embryos achieved, the quality, because it's only by looking at the details that we can improve things to succeed. If you give everyone the same protocol regardless of what they have done before, then I'm afraid you're not doing the best for that couple, because IVF, like anything else, needs to be personalized. So the personalization of the treatment is key, and that's what I'm proud to offer to our patients. That's what I try to do for each of my patients. Try to understand what the problem could be and try to personalize the treatment, tailoring to their needs.
Before we move on to kind of the IVF side of it, Zita, you were just mentioning that when you first have people answer the questionnaire and find out more about them, and you talk about sex and frequency, etc. Do you find that there are often blockers that people haven't found themselves, and that does help their situation?
Yeah, I think there are, because, you know, when you ask that question to a woman about, you know, has anything gone on in the past, that woman that has had something go on won't have any problem answering that question. She'll say, yeah, I've thought about this before, and I've always felt, you know, one of the things is I've always thought it was going to be difficult for me to have a baby. So again, I wouldn't send her straight down an IVF route. It depends on her age and how long she's been trying, like Simone says. But it'd be working through some of the things that might be stopping her. Mm-hmm. And that's important. It's the same with the relationship. So I think that often people need to have a bit of time. So what will happen is we'll make some of these changes within a time scale of 2 or 3 months. And then I will often say, why don't you book in to see Simone in 3 months' time? Mm-hmm. And I think that psychologically, women like to feel they're being proactive. So just because you're having a consultation with a consultant doesn't mean to say you're doing IVF, but they know, you know, we're in July now, virtually in July. We are in July tomorrow, aren't we? So it's like, right, okay, July, August, come September, if nothing's happened and you've made the changes we've suggested, then let's start looking at plan B. And they like that because they don't feel that they're being raced down a path, and that they've got time to make some of the changes they need. And again, what Simone was saying about nutrition, you know, all the doctors have when it comes to IVF is the raw material that a woman produces from her eggs and a man from the sperm. So anything you can do to get those added nutrients in, because that is one of the sort of $1 million questions that women up and down the country ask. Is there anything I can do to improve my eggs or sperm? So they don't want to be told by a clinic, no, there's no evidence to support nutrition, there's no this, there's no that. They want the facts, and there's plenty of evidence to support that the eggs you're growing are affected by the lifestyle. So, you know, we look at vitamin D, we look at inositol, we look at everything we can do to improve the eggs that are going to make it to IVF.
Absolutely. So I had a round of IVF in the States without any preparation. We went to the States due to my husband seeing a urologist there, and the donor sperm we picked, and I had IVF there at the same time. And I was 30 at the time, and we did get embryos, and we did end up having our eldest daughter second time round. However, we went back for a sibling a year later, so I was older. I was probably 32 by this stage. But in between that time, because I had more time to prepare mentally and physically, I went to the Zita West Clinic 3 to 4 months before, saw Isabel, saw Maureen, had a great nutritional plan, started taking your supplements, really looked after my mental well-being, saw a counselor, went running, did all sorts of things just to make myself feel better.
Yeah.
And I don't know whether this is the reason, but the embryo quality was much better the second time we did IVF. And I put that down to the preparation that we put into the cycle prior to going out to America through.
Yeah, I would agree with that. We you know, so many don't we? We test all levels of vitamin D and really get that optimal, because vitamin D is so key when it comes to IVF outcome. And I think what the clients like as well, that nutritional consultation that's part of our IVF, it really gives them an opportunity to talk to the nutritionist, make small tweaks, helping them change what they need to do. Don't you agree, Simone?
Yeah, absolutely. And now, as you correctly said, Zita, there is plenty of evidence, because we are still based on evidence. You know, we base our choices on you know, on what is published. And if you look at the medical literature, there's plenty of articles now talking about vitamin D and the positive effects of nutrition. So there is this is well documented now. So to ignore that, you know, it wouldn't make any good for the couple.
But it was interesting, Eloise, because 10 years ago when we started, or even longer than that actually, we were using vitamin D, and people were highly critical about no evidence. And now you can't open a newspaper without seeing vitamin D related to COVID or other things as well. So I think the lifestyle thing is becoming more and more recognized. But I do think that if a couple coming through, they feel secure, they feel safe, they feel listened to, they get the right advice, it does make them feel more optimistic.
But this is for both. For a heterosexual couple, this is for both, isn't it? Because there can be a lot of emphasis on egg quality in the woman preparing for IVF. But what would you say in regards to a man preparing his sperm?
Yeah, there's a lot that can be done for a man preparing his sperm, and Simone specialises in male fertility as well. But men are slightly more reluctant sometimes to make the changes unless there's an obvious reason to. And having said that, I know we see a lot of heterosexual couples, but we see same-sex couples, we see women that are single as well, or going it alone. Yeah.
Although I have to say that. You know, in recent years, also the attitude of men has changed a lot for the better. They are much more involved in the treatment. They often ask whether anything can be done for them as well.
Yeah.
So I'm assisting to a change in the culture, which is very welcome. And now we have more instruments because, for example, is now pretty proven that just the semen analysis in itself is not enough. There are other things which we ask at our clinic, because again we are always driven by science. So now there is evidence that things like DNA fragmentation of the sperm is equally important, sometimes even more important than just the semen analysis. So to see not just if the sperm comes in good amount, but whether the DNA inside the sperm has a damage, which you can't see from a simple semen analysis. You have to do a specific test called DNA fragmentation. Okay, so this can really make the difference. And on the DNA fragmentation, things like, again, nutrition and antioxidants can really make a difference in reducing the level of DNA damage in the sperm and enabling most of these men either to conceive naturally once the problem is corrected, or if they have to do IVF, to do IVF with much better chance than if they would do this without any intervention.
Yeah. But you are right. I mean, like in the last 10 years, there has been a shift. 10 years ago, we saw couples that drank far more, smoked more, etc. I think people are much more aware now when it comes to fertility in terms of preparing.
I'm definitely seeing more and more commitment from men as well over over the last few years than it was when I started my, well, I have been doing this for about 20 years. So I can definitely compare the change of culture that has been developed during these years. And I'm happy to say that the men are now more and more not only informed, but involved and committed as it should be, because this is not only woman's problem. Statistically it's 50-50. It's 50% for women's reasons and 50% for male infertility. So men have to be involved in the process.
And Dr. Simone, what would you said that sometimes men ask you, what can I be doing to prepare or to help? What would your advice to them be? Well,
they need to follow the same path in terms of preparation their partners, their female partners are following. That's why we always recommend the nutritional consultation for both at the same time. Okay, so they can start the preparation together. And also they benefit, at least most of them, from taking antioxidants to reduce the levels of oxidative stress in the sperm. Even if the semen analysis comes back normal, it doesn't mean that the men can keep their legs up and doing nothing, because even if the semen analysis is normal, first of all, you don't know whether there is a damage in the DNA unless you ask for it. But even if the semen analysis is normal in the first place, I always tell my patient that there is always room for improvement. So the preparation needs to be equally followed by both the component of the couple. It's not just a woman's problem.
And Zita, you mentioned, and we've talked about, and I think quite a lot of people are well educated, that the window to sort of make changes and to see good results maybe three months.
Yeah.
Some people may think, or just not know perhaps, that you need 3 months, and may think that just taking a couple of days worth of supplements, for example, will make a difference. So what's your advice about when people should start those supplements, and what kind of supplements? Because that's a question that we get a lot.
Well, I think if you can do 3 months, great. A lot of the clients that come to us, they're very sort of geared up, Simone, aren't they, on what they should be doing? And some have had IVF before, so they know what they're doing. So I'm a big believer in that, like with nutrition, it needs to be individualized. You can't give the same nutrients to somebody with PCOS or endometriosis or somebody that's older than you would at somebody at 30 that just start trying out. And I don't believe in taking 30 or 40 supplements that, you know, some people will go on the internet to find. So I think that if you're just starting to try a multivitamin and mineral with folate, not folic acid, and folate, not folic acid, but also vitamin D and some other nutrients is important. I think vitamin D is really, really important to take separately. And then an omega-3, a DHA. I think that if there are issues, if you're over 35, then it's looking at other things. If you've got PCOS, it's adding something like inositol and myoinositol, which is really, really good for egg quality. More antioxidants. So, you know, there's a lot of supplements out there, and I think you just need to research carefully what you're taking and where they're from.
Well,
because you have Vitamin and Vitifem, don't you? For both.
Sorry?
You have
I always feel uncomfortable on these channels talking about my vitamins. But yeah, the Vitifem and Vitamin, and there's DHA, and you can find out a lot on the website.
Yeah, and there's also a discount. We've got a discount for you.
Oh, have you?
FH
well done.
So people should go to the Zita West website and use that. You also wrote an article for us very recently about preparation for IVF and for treatment, holistic preparation. So I'm going to put the link to that in the bio as well, so people can have a read, because it just expands on what we've been discussing now. If you're happy.
Sorry, Eloise. Coming back to your question, why 2-3 months? Because there is a biological reason for that, which patients need to know. For both sperm and eggs to complete their maturation process, that's exactly what it takes. I always tell patients, sperm and eggs are not produced overnight. They have to go through a period of maturation from when they start being produced until you can use them for fertilization, which is not less than 2 months. In men is even closer to 3 months rather than 2.
Yeah.
And that's why during all this time is good for our patients to be exposed to the good stuff and not exposed to the bad stuff. That's why you can't expect anything to be working just in 2-3 days, because that won't work. Basically, the sperm and eggs we are getting now have started being produced almost 3 months ago. So for any intervention to produce an effect, you need to wait that amount of time. Luckily, as Zita says, most of our patients, by the time they speak to me for their first consultation, have already started 1 or 2 months before. So by the time they speak to me, they're pretty ready to be booked into treatment if they need to. But that's the answer as to why they need that time.
And you've just sort of answered my question, which was what happens to people who come in, they're desperate to get going straight away with IVF, let's say, or fertility treatment, and they don't want to hang around waiting for a couple of months to try to improve eggs or sperm. Would you advise people to kind of wait, or to crack on and prepare whilst having treatment?
No, I always try to tell them to wait, because we wouldn't do any favor. And differently from other clinics, we are interested in success, not just having people coming through the door and you know, just for business reason. We really want our patient to succeed. Okay, that's why I always tell my patient, when I think they're not ready, it's better to wait a couple of months and have a higher chance rather than to start IVF in 1 week and having to do IVF 2-3 times because it doesn't work.
But also something has to change, you know, so you've got to do something differently the next time round. And we you know, we all think that's important. But again, you know what you're looking at the outcome, which is a pregnancy. And, you know, when you're early pregnant, your growing baby doesn't rely on what you have in any one day. It's the buildup of your nutrient reserves. And I think that for many women and men today, when they're busy, when they're stressed, when they're anxious, you know, you are depleting the body of vital nutrients. And that's why you need supplements. I don't believe in this balanced diet. It just doesn't exist. You know, women are ruled by their moods, their foods and their hormones. Some weeks are better than others. So it's just making sure you're getting those key nutrients.
But you've raised a really good point, because there's a lot of focus, isn't there, on getting pregnant?
Yeah.
But as you said, the Zita West Clinic also focuses on following that journey through. So it's actually then having a healthy pregnancy as well, and a safe delivery. So it's not like you suddenly turn off that switch of the preparation that you've done up to that point.
We support up to, is it 10 weeks, Simone? Is it? Yeah, and then usually women move on to their doctors, the NHS, etc.
I remember when I came to consult with your clinic, and I saw Dr. George.
Yes.
He took all the notes and everything, and he saw the holistic stuff that I was doing with the team. And I was in a very, very dark place at the time. So was my husband. He knew we were looking at donor sperm, and he said, Eloise, through some way you will have a baby this time next year. And he didn't know for sure, but just hearing those words made everything feel so much more optimistic, and just working together as a team really helped support that journey.
Yeah, fantastic.
So we had quite a lot of questions coming in advance. We've had one pop up now, and for anyone who's watching and wants to ask the team anything, please do. So are you happy for me to ask you some of the questions?
Yes, absolutely.
Okay, great. So Zita, this is one for you. Antioxidant pills for men, what are the best type to take?
Well, there's a whole sort of range of antioxidants you can take. And so, you know, if you're taking them specifically for fertility, male fertility, there are a lot on the market that will have been formulated and made for men. And like I said earlier, you know, vitamin D is just as important for men as it is for women. Folate is important for men. I think omega-3, coenzyme Q10, all of these are sort of good key nutrients to take alongside with antioxidants, which are in varying amount in different products.
Mm-hmm. Great, thank you. Someone has got their 4th round of IVF coming up. They've asked, could DHEA help egg quality and quantity?
You want to answer that one, Simone?
I mean, we have to differentiate between DHA and DHEA. So what because they're two completely...
DHEA.
She asked about DHEA, yes.
Well, DHEA, and there has been a lot of misinformation about that. So I will take the occasion to do, hopefully, a bit of clarity. Like anything, DHEA will only work if the body is not doesn't produce it in enough quantity. Okay, so that's why always to be driven by science and not just try things empirically. When we think there might be space to use DHEA, we always ask for some blood test first. So we test the levels of DHEA and the testosterone, which is also important in the patient. And only if we see that the body does not produce enough DHEA, then we consider supplementing it. Because if a woman has already enough DHEA of her own, you wouldn't expect any additional benefit in giving that patient more DHEA. On the opposite, it can be detrimental if it gets too high, because it's then converted into testosterone. So it's always about, again, looking at individual treatment, not giving the DHEA for everyone, but just looking at the single patient you have in front of you, doing the test, being driven by science. What are the levels? Does that patient needs DHEA or not? It's always about that.
And can it adversely affect IVF outcomes, someone's just asked?
I mean, I want to think not too much, because luckily our body is very clever, so it knows when something is too much. And for the DHEA, if you give too much, the body will use only what it takes. But clearly, you will be taking things unnecessarily if you don't need it. And in medicine, the first principle is do not harm. So why should we giving patients things they don't need? So I want to think that it wouldn't do any big harm if it's given unnecessarily, because particularly the DHEA, you would need to give a really high quantity, which we never reach normally to potentially make a damage. It's different from testosterone. Testosterone has never to be given directly, because testosterone can be very detrimental. And that's why it's better to give DHEA, which is then converted in the body into testosterone. So the body will know when to convert, when more testosterone is needed. But never give testosterone to patients, absolutely. Yeah, but to come to your original question, we give DHEA only when I think is needed.
Okay, great, thank you. And Zita, this is one for you. Someone has said, and I know this feeling, that going into treatment, they feel every single day total overwhelm. And thinking about mindset and other techniques, what's your advice for people who just feel day to day that they can't cope with the magnitude of it?
Yeah, it's very hard. Dealing with the uncertainty is really hard. Leading up to a cycle, especially if you had a failed cycle, is difficult. So I would suggest that something like hypnotherapy with Maureen, that would be really, really good and helpful. But, you know, again, it's just training your mind and just doing the best you can through breathing. There's lots of techniques that you can use. You've just got to be disciplined. And I know that, you know, going into despair is much easier than feeling hope. But, you know, you've got to have hope, and you've got to sort of pick yourself up and do your best to get your mindset right. But I totally understand that it's overwhelming.
Mm. Oh, I once arrived at your clinic drenched in rain, having run because I was late. And I said to Maureen, the cycle's failed because I was running in the rain. And she just, you know, she calmed me down, gave me some techniques. I got in the chair and started to relax and almost fell asleep. It was just magical. Yeah,
and it's the support you need as well. It's really hard, and you know, that's what I was saying, that the mind is like an unstoppable train. All these thoughts that are coming in the whole time, and for every thought you have, there's a chemical reaction in the body, which may cause stress. It may cause your cortisol to rise. That's why if you can do visualization or practice some of these techniques just to distract yourself and just to calm your mind, it's going to have other benefits for you.
Because there is a worry, isn't there, especially for someone who is a worrier, that overthinking things and overstressing about it, you feel like you're doing damage to the cycle working.
Yeah, absolutely. And that's why, that's why you've got to sort of change the neural networks you're working with, and through using techniques to strengthen your mind.
That's great. Thank you. And another one which came in, which was quite a nice one to cover, was how to prepare your partner who's nervous for you.
Is that to me or to Simone?
I think this is more from it could be both. I guess, you know, psychologically, but also in terms of maybe helping with injections and things like that, and being part of the process.
I think it's hard for men as well, because men want to be optimistic, and they're more optimistic when it comes to going through IVF very often than their partners are. I think your relationship is really important. I think communication is absolute key, and we've all seen it, Simone, haven't we, where a couple will come in after 4 cycles and you can see that they're starting to become distant. So I think communicating, talking, and anything that he can do to help that you're happy to do is great. You know, sort of you're in it together, really.
And do you think medically it can be a nice way to include a partner as well, if someone's helping you with injections and things like that?
Yes, a lot of men give injections, don't they, Simone? Yeah.
That's great, thank you.
And emptying the dishwasher and cooking,
letting you put your feet up,
hoovering, and all sorts of things be helpful.
The signal gone a little bit.
Is it gone, Simone? It has gone a little bit.
Sure,
I think it must be in the clinic.
Let's read some of the questions that have come through. They may be medical. Can you still hear us?
At home, do you really?
We are having problems with the connection, aren't we?
Yeah.
Does anyone have any questions for Zita whilst we're waiting for the internet to restore? Zita, do you have any advice for people who are feeling unwell from medication?
Yeah, that's a difficult one, because it does affect some women in a different way. They feel bloated, they feel emotionally fragile. I think you need to talk to your nurses and doctors and just make sure there's no underlying factors going on. But I think it's important to try and rest as much as you can and sleep. You know, energy is really, really important to have. So I know it's hard if you're working, but you know, try and take the time you need, because it does affect some women worse than others.
And what about if you struggle with insomnia?
Oh, that is really, really hard. Maureen gives techniques for that. So there are apps available, there are sleep apps available, and a lot of women do suffer from insomnia, especially if they're on drugs such as steroids, because I think that they really sort of wire you to the moon. You've just got to do the best you can and rest during the day if you can.
Can you hear us, Dr. Simone?
Yeah, I can. Can you hear me?
Yes, that's perfect. Thank you.
Good.
A couple more questions, if you've got time, just very quickly. And this could be to both of you, actually, because I know that acupuncture can be good for this too. But how to help blood flow to the uterus?
Well, acupuncture they have done some studies to show that it can help with pelvic blood flow. The more blood flow you've got, the better the health of the ovaries. So that's definitely worth doing. I could see there was another question that came through here as well, that if somebody wanted to come to see us, would they have to start everything all over again? And the answer is no, isn't it, Simone? As long as they've got their tests from a year. Is it a year?
I mean, most of the tests are valid for at least 1 year. The effective screening is valid actually for couple who have had IVF before, is valid for 2 years. So HIV and hepatitis B and C. So I always try to keep as many previous tests as possible as valid. And I only ask for those I really need to be renewed. So, yeah.
And also you can get your notes from your clinic. You know, you can transfer notes. That's what people are worried about.
And as I've put the article that you wrote for Fertility Help Hub in the link in the bio, so people can contact you through that, or they can contact you directly through the clinic or through Zita's Instagram. But we've had another question, which is, going back to hypnotherapy and apps like Calm. Can you explain the difference in terms of seeing someone in person and following an app yourself?
Yeah, I think, you know, when you see somebody in person, you get a more individualized session, you know, because everybody is different. Everybody comes to fertility with their own unique set of baggage. So if, for example, you were coming to see someone like Maureen at the clinic, she would sort of like take your history and work out what you needed over a course of 3 or 4 weeks and give you techniques to take home. Having said that, apps like Calm, there's lots of apps out there for sleep, are good to use as well. And not everybody can afford to have hypnotherapy, but it is a more individualized, tailored treatment with different scripts that are relevant to you.
I actually use some of Maureen's techniques in other areas of my life now.
Yes. But it's interesting, isn't it? Because these techniques that are really useful when you're going to a busy clinic and doctors are running late, not you, Simone, of course. And you know, you've got to sit and you've got to breathe, and you know, it's managing. And you know, when you're going through IVF, Eloise, it's such an up and down hill to get to the end, to get to that transfer date. So many things can happen along the way. So you do need to be able to breathe. You do need to be able to sort of build in some of these techniques.
Well, I would say also for the 2-week wait, because you've had your hand held, haven't you, up until then? And then you're on your own until you test.
Yes, yeah. And a lot of couples and women feel that when they've got pregnant with us, that they think they're going to be really absolutely delighted, which they are for about 5 minutes, and then the anxiety comes in. And many of them say, Simone, don't they, when they leave after their 9-week scan, they just feel on their own. You know, they don't feel cosseted anymore.
And in terms of preparation, can you help people at the Zita West Clinic with counselling as well?
Yes. We've got Jane Knight, who does counselling, who's excellent. And all women are entitled to, is it 2 counselling sessions, Simone? Yeah.
And that's very important. I'm glad that you have touched base on that, Eloise, because we are very lucky to have one of the best counselors, I believe, Jane. And we include this in every IVF cycle. So in every IVF cycle, there are 2 sessions with our counselor, inclusive in the package, and that is very helpful. And we offer this at any stage, because some couple might need help before embarking in the cycle, whereas some couple would need to talk to the counselor after a failure, for example, to overcome the disappointment and to go through that. So, but yes, I think the possibility to talk to an experienced counselor is invaluable. It's not something, you know, the IVF doctor can replace, or any other figure in the clinic. There is a specific space for each professional, and that is what we are proud to offer. We are lucky enough to have excellent specialists to cover any area. And that makes really a huge difference.
And for donor conception as well, very, very important, isn't it? If you do have access to counselling, to
implications counselling is very important. Yeah,
and also to be able to speak to someone who isn't the person you might be trying to have a baby with.
Yes,
or
that's
family.
Very true. That's very true. Yeah.
Well, thank you both so much. We've had some questions on embryo quality and things like that. I think there's one also that's come through on immunology. I don't know how you're doing for time, but I would say, you know, please feel free to send them on to me and I can put you in touch, or equally if you want to contact Dr. Simone directly in the Zita West Clinic directly, then please do as well.
Yeah, I can just read a question I would like to
thank you. If you've got time.
From a patient, who says that her eggs went from 10 to 5 in 6 months.
Yes.
And unfortunately, she couldn't reach any blastocyst on this round. And she was put on a higher dose, and she's wondering why having been put on a higher dose could be the reason for a worse performance. Yeah, I mean, like everything, to answer better this question, I would need to look at everything, all her previous cycles, any different, not just in the dose of the medication, but what protocol has been used before, which medication, whether there was a difference. But yeah, sometimes potentially a too high dose could make worse results, because it's not the more the better. You know, you need to assess what is the proper dose and the proper protocol. If you give a too high dose or a too low dose, you can compromise sometimes the treatment. So yeah, so again, the treatment will need to be personalized.
And that leads on to the next question, actually, which is a good question. If you don't get any blastocysts in a cycle, despite taking supplements, eating healthily, looking after yourself, what should you do? What would you look at doing?
Well, I thank you for this question, because I mean we are lucky within care to have access to the to cutting edge technology. So things like, for example, we can do a lot of things which other clinics can't offer when things go wrong for unknown reasons. We have things like, for example, just to mention one, oocyte activation, which is supposed to improve in selected cases the blastulation rate. So the amount of embryos which might reach blastocyst. We have recently started using the zymote to better select the sperm, and this will enable us to select the sperm with less DNA fragmentation. So there are a lot of things which we can do differently from other clinics to deliver that level of personalized care, which for some couple really makes the difference between achieving 0 blastocyst and getting 2-3 good quality blastocysts. I've seen that before, just by tweaking a few things. I've had patients moving from 0 blastocysts or very poor quality blastocysts all the time to be able to freeze 2-3 top quality blastocysts. So it can really make a difference. But again, you need to find what is the problem for that couple and try to find a solution to improve that.
That's great advice. Thank you. And so was there anything else that has come up, or do you think that we've covered most things? As I mentioned, please do feel free to contact the team at the Zita West Clinic, who will be able to help you.
We won't be able to take individual questions. It will have to be, like
for a consult. Yeah,
you've got to have the medical background for it. So we can't sort of do it that way otherwise. But also, I'm on IGTV a lot, so a lot of topics that we can cover.
I mentioned that I'm going to put the link to the article that you recently wrote about preparation, which is what we've been talking about today. So I strongly advise that people go and read that. And then if you want more information, please do, as Zita said, book a consult with the team, who are more than happy to expand and help for personalized care. And we've also written an article which will be coming out next week on unexplained fertility. So that will be another interesting lot of advice from the team here. So keep posted for that. And thank you both so much for your time.
Oh, thank you, Eloise, and thank you, Simone. I know you've had a busy day, but really enjoyed it, and I hope it's helped the viewers.
Absolutely. Okay. Thank you to both.
Take care, Eloise.
Have a lovely evening, everyone. Thank you.
Bye-bye.
Bye-bye.
Bye.